Hi, welcome back and thank you for coming to see our video on our weekly COVID-19 community update. Today is Tuesday, May 25th, and I'm Josh with the Fishers Health Department. So today I'm really pleased to announce that in terms of our community risk rating, we are starting to see a decline in our primary metrics that indicate that we may be able to move from our orange level 3 category to our yellow level 2 category in the next coming weeks. So right now, the Hamilton County positivity rate stands at 7.0%, which itself is in our yellow category. The Fishers testing site positivity is at 3.52%, which is in green again this week, so that's 2 weeks in a row for that metric. And our case incidence rate, where this is the 14-day rolling average of cases per 100,000 residents, is 9.03, and that itself is also in the yellow. So the Hamilton County positivity rate and the case incidence rate have moved from orange to yellow this week, and our testing site remains in green. Overall, the primary metric area remains in orange because we are looking for stability in these metrics before we move the community risk rating level guidance down. So we'll be looking for this to stay stable for about 2 weeks, and if these metrics do so and the other two metric areas also remain stable, then we would advise removing our community risk ratings down. So stay tuned for that, but this is exciting news. In terms of our secondary and tertiary metrics, there is not much of a change here. Testing is available. You can come to our testing site, and there are other testing sites around the area as well. Turnaround for the test still remain at about 1.5 days. Sometimes it can take a little bit longer, but turnaround is doing quite well. And our contact tracing team, as always, does a fantastic job in contacting all close contacts within 24 hours. Now, in terms of the hospital system capacity, our tertiary metric, there's been a slight decrease in the ICU bed availability, down to 30.7%, but there still remains quite adequate ICU bed availability in our district. So that's Indiana Department of Health District 5. The new daily hospitalizations remain where they were last week on a trending decrease, so that's really exciting to see. So again, overall, we are still in this level 3 orange category, indicating that there is a risk of transmission within the community that's more significant than what we'd like to see, but our primary metrics areas are trending in the right direction compared to last week, so we're very excited to see that. So we'll be posting our updated dashboard on the website soon, later today, but I wanted to share this with you. Again, you can see the percent positivity is down to 7%. The new positives or cases over the last 14 days is at 91, that's quite low. But when you look at the graph at the bottom here, where you see the cases per day, and then the red line is the rolling 7-day average, when we look at May 11th, which is right down here, that number is the same as what we saw in early July. So we are at the lowest 7-day rolling average of new cases since we have been for the last 10 months, which is really exciting news. And this is something I'll focus on a bit more in terms of where we are with that 7-day rolling average and the number of cases. But I want to touch quickly on the age-specific COVID case rate per 1,000 residents. So this is the average number of cases per 1,000 residents for the age group. It's plotted on the graph behind me over the last 8 weeks, and then the dots represent the 4-week average for that age group. So we are seeing up here in the 1.55, 1.38, and 1.27, that represents the number of cases per 1,000 residents for that age group, and those are age groups. The highest is 16 to 19, next highest is 20 to 29, and the third highest is the 12 to 15-year-old range. So these are age groups that have been eligible for the vaccine much shorter period of time than the older age groups, so they have a bit less coverage than our older age groups, and it speaks a bit to where the cases are concentrating now. And it also reflects a bit on the benefits of having our older population being eligible and able to get the vaccine, and having high rates of coverage is helping to also decrease the spread of cases amongst those older groups. So in terms of vaccinations, as we've reported for the last several weeks, Fishers residents, thank you so much for going out to get vaccinated. If you know someone who hasn't had the opportunity, please do assist family, friends, acquaintances, colleagues, loved ones to receive their COVID vaccine. It will offer them a level of protection that they wouldn't have without the vaccine. But Fishers, in general, as a jurisdiction, is always doing extraordinarily well when we look at other jurisdictions across the state. So our total first dose coverage for those aged 12 and up is at 65.68%, and the total percent of the population that is fully vaccinated, 56.01%. So this was as of last Friday when we received the data from the state. And when we look at this, we are continuing to outpace all of the counties in the area on first dose rates. In fact, when I looked at the comparison early Friday morning, Fishers had 65% coverage. The next closest county was at 60%. So again, thank you so much for going to get vaccinated. The table that you see on here shows you how we're doing on the 7-day period ending on 5/20, so that's when the data goes through on the vaccination data we receive, compared to the previous 7-day period where the last date of vaccination was 5/13 in that file. So we're seeing really nice increases across our age groups, and particularly when we compare it to Indiana as a whole, we have several age groups that are doing very, very well compared to their Indiana peers. Here is the graph of the vaccination coverage by eligible age groups. We have 3 age groups that are at the 85% or higher fully vaccinated coverage. That's 60 to 69, 70 to 79, and 80 plus. This is fantastic. We're seeing very nice and measurable and large gains across the other age groups. We want to continue to see this trend happening, so please do go out and get vaccinated. When we look at cumulative first dose vaccinations by age group, so I've collapsed the age groups here to 12 to 19, and then by 20-year age groups, 20 to 39, 40 to 59, 60 plus, and our overall population, the blue line. So you can see that the 60 plus has 92% coverage for those residents. The 40 to 59 are at 73% coverage. Again, this is first dose. The overall, our population, as I just mentioned, 65%. The 20 to 39, 55% first dose. And the 12 to 19, 38.1% first dose. So that is very, very exciting to see. In fact, we had over 1,400 12 to 15-year-old residents receive their first dose last week, and that is really exciting. So I'll end on touching on our pop-up clinics. You'll see these at the farmers market that I've mentioned. So if you come to our farmers market, please do stop by where the testing site is, and that is where we will have vaccinations available as walk-up at the farmers market each Saturday this summer. If you would like for us to come to your business, organization, community group, neighborhood association, do reach out to us, contact us, and we will send the vaccine to your local area in Fishers. As always, let's get this 85% coverage across all the age groups. I just want to say I'm so amazed to see how quickly our residents are taking up the vaccine, and we'd love to see this trend continue. Please do reach out to us if you need any assistance with the vaccination, or if you have any questions or need any assistance with any other health-related matter. We are always available to discuss with you, especially COVID-related instances, but everything else, if you have questions for us, you can always email us and you can call us. Thank you so much and have a wonderful day.